Good afternoon, everyone. Today is January the 30th, and I'm Lizzie. Here is WallStTV. Today, I have a very special guest with me. Her name is Syra Madad, Dr. Syra Madad. She's a Senior Director of New York City's Health and Hospitals Special Pathogens Program, which helps develop public health strategies to ready New York City for major diseases. But she also made appearances in the new Netflix docuseries. So what was that experience like for you?
It was a wonderful experience. I think that being part of this docuseries, it helped highlight the various preparedness efforts that is happening all around the world. I was just one figure of that. There was a number of other individuals that are doing amazing work to really help prepare the world in responding to these types of incidences.
Great. Congratulations on the successful launch of the program.
Thank you.
So, I basically watched the docuseries in one sitting and I loved it. And there was one quote that was especially memorable from that docuseries, in which you said, influenza is very hard to predict, so that's easy to understand. It takes one person, one host, to lead to a pandemic. So can you just unpack that statement a little bit for me?
Yeah, so it certainly does just take one person, and that's what really starts this whole chain of infection, this whole chain of transmission, if you will. It just takes one host, and then that one host can be an amplifier to the rest of the world. And that's certainly what we've seen in a number of different infectious disease outbreaks, as history has shown us. Similar to this current novel coronavirus outbreak that's happening in the Wuhan province in China, we're not exactly sure how this outbreak started. That's still an unknown. There are a couple of speculations, but certainly what we do know based on science and just basic, epidemiology, that it just really just takes that one person to start, if you will, a pandemic.
Right. So that's really alarming. But, the news is really moving pretty quickly these days. So just, what's the latest in terms of spread, infections, and fatality? Just give us the data on the recent outbreak.
So right now, the data is still coming in, and in terms of just real-time cases, just a couple of hours ago, I've seen a case count of over 7,000, but in another kind of public health website, you're seeing a case count of over 8,000 confirmed cases, over 170 deaths being reported. Just outside of mainland China, over about 70 to 100 cases being reported in 17 different countries. So this is something that, in terms of number of cases, constantly fluctuating every minute, every hour.
Right. And I think, just in this past hour, CDC just announced the first case of human-to-human transmission in the United States. So can you just, help us learn, what's the significance of human-to-human transmission in the United States, and should we be alarmed? If so, why?
So certainly, I think there's a lot more that we need to learn more about it, but we do know that there has now been reported cases of human-to-human transmission of the novel coronavirus, which is not unexpected. This is something that is expected, given it's a respiratory disease. We were just waiting for some more data to come about to confirm that there is human-to-human transmission. What we don't know is how sustainable this human-to-human transmission is. Is it going to cause additional secondary infections and things like that? But right now, we do know that it is causing, secondary infections in certain individuals.
Gotcha. So, another thing is, you mentioned those numbers, but, to me, it seems like most of the numbers are coming from Chinese data. So those are official numbers. And when we talk about Chinese data, there's also the suspicion that those numbers might not be in keeping with reality. There might be cases of underreporting. So do you think that's the case here? I mean, from international community, you hear that the Chinese side has improved a lot in terms of, being transparent and being upcoming in terms of their data. But how much confidence should we actually give to those Chinese data?
So right now, the World Health Organization has applauded Chinese Ministry of Health in their transparency. They've been much more transparent in this current outbreak compared to the previous outbreaks. For example, SARS in 2003. They have been releasing data and additional information, which has been great to the global health community. In terms of underreporting, I think certainly that is another unknown. There has been speculation that there's a lot of underreporting right now. While we may have, 8,000 cases, there's over 12,000 people that are suspected to have the disease. Some mathematical models show that the current disease count is probably in the over 10,000 range, but we're not exactly sure if that is true. But I think just because this is obviously a novel developing infectious disease outbreak, that is something to be expected of. I think one thing to also note is that when we talk about the number of cases and the number of deaths and the number of those that are critical, we need to obviously take that with a grain of salt. And the reason for that is because of this underreporting underreporting. So if we're saying that there's 8,000 cases, but there may be underreporting, and there may be, let's just say, 10, 20,000 cases, if you will. The number of those that have, associated with fertility and those that are severe, that overall percentage diminishes quite a lot, and then it puts the overall disease into more perspective. Is this a more severe disease versus a mild disease? But again, there's a lot of unknowns, and we're still trying to, figure out from a global community standpoint what the overall transmission severity is of this particular novel coronavirus.
Gotcha. That's super helpful. So, one thing I always heard about this, this Wuhan coronavirus outbreak is, in terms of severity, it's more infectious than SARS and MERS, but it's less virulent in the sense that the fatality number seems not to be as large as the case of SARS. So, is that an accurate assessment based on what we already know? And does that how does it compare with SARS and MERS? And from our past experience,
I don't think it's fair to probably compare it to SARS and MERS. While it's in the same coronavirus family, it is a different disease, and because still there's a lot of unknowns in it, I think it's probably an unfair assessment to say that it is more or less virulent than MERS or SARS. The data is still coming out, and what we have seen is that it could be a severe disease, it could be a mild disease. It's really right now at this point too hard to tell, and because of the overall case count and potentially underreporting, right now if you look at the disease and you look at the fertility and the number of those that are in critical condition, they're saying about 17 to 20% are in critical condition. That does put the disease in a more severe state, but again, in the overall context, if the actual case count is 12,000, 13,000, 15,000, that number completely diminishes in terms of the overall severity of the disease. So right now, a lot more to learn, and this is a novel disease, as we know, and I think just from that perspective, we just need to rely on the Chinese authorities to provide some more information along with the global health community to see what we're actually seeing.
Right. Speaking of the Chinese government's effort here, so I think the most dramatic move in the past few days was the complete lockdown of the city of Wuhan, which is the source of the outbreak, and also neighboring cities. So the total affected population is more than 50 million people. So now we have a quarantine of the magnitude of 50 million people, and that's basically unseen in human history. So do you think that was an effective measure? Was it a right move? Or do you have your own assessment of the situation and your best course of response?
So any way that we can socially distance folks from one another from a basic public health standpoint, from a basic infection control standpoint, obviously that is helpful. However, putting these types of draconian measures in place have not proven to be very effective based on just what we've seen historically, based on the SARS outbreak in 2003, based on the Ebola outbreak in 2014. People obviously, and rightfully so, they're not supportive of sometimes these types of measures. And what may happen is, well, there's a will, there's a way. So if you want to leave that country, you'll potentially find a way to get out of that particular area. And if you're infected, now you're spreading that disease to other parts that you're going to. And from a public health standpoint, we may not be able to track that particular individual because we think that they're confined in that current area. And that then amplifies the overall disease. So I think there's a lot of issues at play here. Whether it's going to be effective, time will only tell.
I see. So, in terms of governmental response, we're also interested in what the U.S. is doing right now. So can you just, give us a sort of a big picture idea of, what are the government agencies that are involved in this and what we are doing in terms of response?
So there has been a very big domestic response to the novel coronavirus, and rightfully so. This is right on everyone's radar that's in the public health community. So Centers for Disease Control and Prevention has taken a very strong stance. They are constantly monitoring the situation, along with a number of our other public health agencies like ASPR, FDA, NIH, and the like. And one of the things that has come out just as of this morning is President Donald Trump's administration has put together a task force of infectious disease experts to look into the matter further and see what else from a domestic standpoint that can be done. But the overall risk just to the American general public is low, but the public health response has been very aggressive.
I see. So, in terms, in general, do you think this current administration is doing a great job in terms of, supporting public health programs, or do you see, room for improvement in how we respond to, crises like this?
There's always room for improvement. Whether you have something that is 100%, you always want to reevaluate and make sure that you are constantly making an effort. So I think in terms of our current public health strategy, it's great, but obviously can always be improved upon. And I think one of the things I would love to see is, in 2014, Congress appropriated funding to develop this whole regional Ebola and special pathogen treatment network. And so you have frontline hospitals, assessment hospitals, Ebola treatment centers, and regional Ebola and special pathogen treatment centers that help prepare the United States for highly infectious diseases. The funding is set to expire in 2020, and there hasn't been any announcement of reissuing funding. And so one of the things I would love to see from a funding standpoint, that this structure continues to get funding, so that way, at least on a domestic standpoint, we're prepared for these types of events.
Gotcha. It's always great to be prepared before the outbreak actually comes. So another thing that we hear a lot in the researches and also in media reports is that this disease can actually spread before you actually get the symptoms, and that seems especially dangerous. So can you just help us understand how that works a bit more?
Sure. You're correct. What we have seen right now is that this disease can be transmitted while you're still asymptomatic. And what that means is that you're not showing signs and symptoms of the disease. And while you're infected and you're not showing signs and symptoms, you can still spread it to others. This is similar to seasonal flu, where you become infectious 1 to 2 days before you actually show signs and symptoms, and you're able to spread the disease. So that is very worrisome, knowing that information with this current novel coronavirus outbreak. And so folks can be on the subway, going to the mall, to the theaters, and then unfortunately spreading the disease because they're not showing signs and symptoms. And this is another issue where when you talk about quarantine of healthy individuals, and even the movement of folks, from one country to another, while we were having airport screening done in the United States, if they're not showing symptoms, they're going to evade that travel screening. And so current data shows that over maybe 50% of those will probably miss because there may be asymptomatic carriers.
So 50% of people who actually have the disease, because they don't have the symptom, like high temperature, they can still pass.
That's based on some of the data that we're seeing. It's not 100% reliable, but right now we're seeing that potentially more, about half of those that are going to go through travel screening may bypass the whole travel screening because they may be asymptomatic. But this is something that we'll learn more about as additional data becomes available. And usually that won't become available until after the outbreak is over, since we get a totality of the overall incident.
I see. So another term we hear a lot is incubation period, and that piece of data seems to be all over the place, right? So some put incubation period as low as 5 days, and some at higher end of the estimation we have 14 days. So what's the best piece of scientific evidence we have in terms of incubation period of the virus?
What we're seeing is that you can, become infectious anywhere between 2 to 10 or 14 days of getting this particular virus. And so right now, the clinical case definition that the Centers for Disease Control and Prevention have come out with, and this is what hospitals and other healthcare systems are following in terms of travel history, is anyone that has traveled to the epicenter within 14 days, because that is within the incubation period of this particular virus. But again, we still don't know some information in terms of the overall epidemiology, but right now we're going with that 14-day mark.
I see. So another special thing about this outbreak is it happens sort of right in the middle of the flu season, and that makes it complicated since many of the symptoms of the coronavirus is actually pretty similar to like a common flu. Right? So how does that complicate health professionals' efforts to contain this outbreak? And so if I get a cold, how can I tell if it's a flu or is it the coronavirus?
Excellent question, and I think you bring up an excellent point. So we are in the middle of flu season, and some of the signs and symptoms of seasonal flu very similar to the novel coronavirus. So fever, cough, shortness of breath, things like that. And so I think it's very difficult from a healthcare system perspective, if you're coming in with those hallmark signs and symptoms that are very generic, to be able to obviously identify these patients. But then you have some additional information. For example, have they traveled? Have they come in contact with somebody that has traveled and has been sick? But the basic infection control measures are exactly the same. So if you want to do something in terms of protecting yourself and those around you, whether it's for seasonal flu or for the novel coronavirus, take the same steps. If you are sick, stay home. If you need to see a healthcare provider, let them know ahead of time if you've traveled or been in contact with somebody that has traveled and you think you have the novel coronavirus. But more importantly, get your flu shot. Right. And so one of the things that you can help with is that if you get your flu shot, your risk of getting seasonal flu diminishes quite greatly. And so if you have your flu shot and
I get sick.
Exactly, get
gotcha.
sick, you know, and you've traveled to that particular part of the world or you've come in contact, well, then we know that there's a higher chance of you may having this versus seasonal flu.
Gotcha.
It also helps healthcare delivery systems because it helps us know that, okay, you've got your flu shot, and the overall folks that are coming in to seek help, you know, it lowers the overall burden because folks are getting more vaccinated against seasonal flu.
Gotcha. So that's a really helpful tip. I mean, get your flu shot, and then, you know, if you get sick, we know it's probably something else.
Yes, I mean, obviously with seasonal flu, you know, it's not 100% effective, but again, there is, you know, a higher likelihood since you've gotten your seasonal flu shot. And right now, just in terms of stats, you know, 15 million Americans have already gotten sick with seasonal flu. There's already been 8,000 deaths reported in the United States alone. So this is a much more bigger issue in terms of infectious diseases and respiratory diseases. And actually, seasonal flu is the #1 threat to the American population.
I see.
If you look at it from an actual standpoint than the novel coronavirus.
I see. So yeah, so, you know, you spoke about the seasonal flu. I think, you know, for some people who want to, you know, downplay the importance of the coronavirus, they always make the comparison with the seasonal flu. They're like, oh, you know, in the US, every year you have like, you know, 60K cases of, you know, death from the seasonal flu, and now we're only like, you know, in the hundreds. So this is not as serious as a seasonal flu. There's nothing to worry about. Is that a fair comparison? If not, why? Like, how should we understand those numbers in terms of the statistics?
I think we need to be more worried about things that will affect us day to day. The novel coronavirus is still a developing story based on public health statements, and as we know, the risk to the general American people of getting the novel coronavirus is low. That may obviously change. However, right now we want to focus on things that we can immediately be able to do, and that is obviously for seasonal flu.
Right.
I think it's, you know, a comparison to, you know, when people think about terrorism, they're very fearful of terrorism and potentially dying from, you know, a bomb threat and things like that. But folks get into the car every single day, so you're more likely to get in a car accident and potentially pass away from a car accident than obviously passing away from terrorism. So putting things into perspective, in context, things that obviously we are more fearful of versus those that actually have an immediate threat to us right now.
I see. So yeah, I mean, and one example I always remember is, you know, the shark bite story. I mean, those stories grab the headlines, make people really worry when they go to the beach. But, you know, getting into a car accident is much easier than, you know, getting bitten by a shark.
That's right.
Right. So yeah, you know, speaking of sort of preventative measures, I think, you know, you mentioned that, you know, it's probably more important to get prepared for seasonal flu, and a lot of the precautionary measures are similar in terms of what we should do at this point. You know, washing our hands, practice good hygiene and stuff like that. But I think, you know, people are tempted to, you know, take extra measures when, you know, when there's sort of a new thing, right? This coronavirus outbreak, and now there seems to be this rumor, or not rumor, just you know, information about like how effective face mask wearing can be, and there's actually been sold out on face masks, you know, in all the CVSs around town. So how effective is it to wear a face mask in terms of, you know, preventing coronavirus from, you know, getting into your system?
There's different types of face masks, and I think it's important to define the different types. So there are surgical masks, and then there are, for example, N95 respirator masks.
Right.
N95 respirator masks are those what healthcare workers wear, and they're fit tested for it.
Right.
And these masks filter through different particles that are in the air, or with over 95% efficacy. So with the coronavirus, these are viruses that are very small in the microns. You can't see them with the naked eye. You need specialized, sophisticated microscopes, for example. And so they actually filter through those types of, you know, microbes that are in the air to provide protection to healthcare workers. Now, the masks that people are wearing are not the N95 masks. They're wearing these surgical masks. It does not provide the same level of protection. There's no data to support that they filter through airborne particles. Now, there is limited benefit to it, not that it's filtering through these airborne particles, but at least it prevents you from touching your mucous membrane, so touching your mouth or your nose. But your eyes are still exposed, so that's another portal of entry.
I see.
And so there is limited data to actually prove that these masks are useful in this type of context. If you're wearing a mask to prevent yourself from getting the coronavirus, it won't, you know, it'll provide limited, you know, protection, because obviously it can still filter through. But in terms of just basic infection control, if your hands are contaminated with various microbes, it prevents you from at least touching your nose and your mouth. But I think another thing to add is that folks need to look at the manufacturer's instructions. And so, if you're constantly moving around your mask, well, then you're breaking any barrier that you've established. In addition to that, if you're wearing the mask all day long, that's a breeding ground for germs. The other thing that I'll mention is the masks are usually worn for people that have already been infected with the virus to help prevent it from spreading to others, not the other way around.
Gotcha.
So if you're a healthy individual and you're wearing a mask, again, it's not filtering through the microbes that are in the air, the airborne particles. So we tend to provide a mask to, for example, patients that maybe are exhibiting signs and symptoms of, a respiratory disease to prevent them from spreading it to others.
I see.
Not for a healthy individual that has no signs and symptoms.
I see.
that context.
I see. And then sometimes I see people sort of wearing those N95 masks, but there seem to be gaps all over their faces.
Yep.
So basically that won't work either if you have those gaps. It's just not going to filter.
Exactly, because the whole point is to filter out any particles that may be airborne, whether coronavirus or other types of viruses, or microbes that are in the air. And obviously, if you don't have that perfect seal, then it defeats the purpose.
I see. And also when we chatted offline just a little while ago, you mentioned that there seems to be a global short in supply.
That's right.
Of those masks. Can you just give us an update on that, and what measures are we taking to counter that?
Sure. So actually, as of this morning, the World Health Organization and the World Economic Forum have established this network for pandemic global supplies, and over 350 suppliers are on there because of obviously this PPE or this personal protective equipment shortage that we are starting to see in certain parts of the world. Certainly in China, we're starting to see it a little bit in the United States, obviously locally at these commercial pharmacies where masks are obviously being sold out and not available on the shelves anymore.
Right.
And so certainly from a standpoint of the global supply chain, they've developed this infrastructure to get a good tab of where we are with this supply. But I think something we need to continue to keep a very close eye on because, again, folks are fearful. They want to do something about it. They think that the mask is something they should get versus those that actually need it, in the hospital setting.
I see. But also, prevention is just part of the story. I think, as sort of the general public, we're also concerned about diagnostics and therapeutics. So what's the latest on those fronts? What kind of diagnostic tests we have, how effective they are, and what kind of therapeutics or, measures we have already in place and what we're developing right now.
So from a diagnostic standpoint, the process we have in place, at least at the New York level, is that we would send samples that have been collected to our local public health department.
Right.
And the diagnostic testing is right now being done at the Centers for Disease Control and Prevention in Atlanta. That's where they have the PCR assay to actually run the test. And then there is a pretty fast turnaround time right now. Similar to the Ebola outbreak in 2014, there was an emergency authorization use by the FDA to be able to have public health departments do this testing. That is something that probably will come out soon. It hasn't actually been authorized yet. But right now the process is it would go to the CDC for actual PCR testing from a diagnostic standpoint. In terms of the overall therapeutics, there is no medication that has been proven to obviously work against the novel coronavirus. There's no vaccine available right now. Everything is supportive. If you're obviously in a more critical setting, then ICU type care is something that will be provided.
Gotcha.
But just in terms of overall therapeutics, antibiotics won't work because this is not a bacterial infection. So just from that standpoint, it's supportive therapy.
Gotcha. And are there should we be optimistic that those therapeutics like cure, medication, also vaccines, should we expect them to come out anytime soon, or are we going to wait for a while?
So there does seem to be a really great global response to the novel coronavirus. CEPI is an organization that has invested in over $12 million in 3 different pharmaceutical companies to help develop a vaccine for it.
Right.
So I think we may hopefully see a vaccine either by summer or within a year or so. Obviously, it takes some time to develop a vaccine for any type of infectious disease threat. So in terms of turnaround time, we can't really say, but we are hopeful that a vaccine hopefully will be made available but again, no promises there. It just really depends on what the best candidate is, and then you have to go through the whole process to prove that it's effective and safe and for humans. In terms of therapeutics, I'm sure that there are antiviral medications out there. In terms of it being effective against the novel coronavirus, is something that's still being explored, and hopefully, from a global standpoint, we have amazing scientists and researchers throughout the world that perhaps are obviously looking into it and seeing what can be done.
Gotcha. So I also wanted to, have you comment on, the international community's response to this novel coronavirus outbreak. I think, one especially controversial move was by WHO for basically postponing announcing this being a fake event, and fake is not. It's not genuine versus fake, but it's so public health emergency of international concern. I think WHO will reconvene this afternoon to update on that decision. But from your personal standpoint, do you think they made the right decision when they decided to postpone announcing this being a fake event?
So from a World Health Organization standpoint, and this being declared a public health emergency of international concern, I don't think that it's not a fake event. They just don't have enough information to actually declare this a public health emergency of international concern. They, based on Tedros' statement, this is something that they're taking very seriously. They know the threat is very high in China, and even at the global scale, the threat is high. But in terms of the actual clinical information, the scientific information and epidemiological information, they just didn't have enough to actually make a decision. So they are reconvening, as you've mentioned, again later today to reassess the situation. And I think just to talk a little bit about what this actually means, a public health emergency of international concern, it has been, so this declaration has been made about 4 to 5 times since 2009. This is not something that is taken lightly, but basically what it does is that it opens more political collaboration and potentially more funding sources at the global scale. And so I think at this point, we still don't have enough, but we do have at least some information to know, the virus is transmitting human to human. There's been 17 other countries that have reported, cases. Thousands of new cases are being added every single day. So I think that based on those concerns, I think it may be time to declare this a public health emergency of international concern. So that way there will be better, collaboration at the global scale to provide some resource and support. But again, we'll see what the experts from a global and public health standpoint have to say later this afternoon.
Right. So, when we talk about like a pandemic like this, part of the toll is human toll. There's there's a toll on people's public health and stuff like that. But also sometimes it's also psychological, right? So when during a time like this, words and rumors spread as fast as the contagion itself. And there's one thing that it's pretty worrisome to me. So I have this friend who is a Chinese American. When she went on the bus, the person basically sitting next to him is just immediately grabbed his stuff and changed the seat. And she was like, oh, was it because I look like an Asian? And so people think I am carrying that virus. So how should we react to that? I mean, part of it is fear, and fear is natural, it's human, it's inevitable. But that also opened up some new areas for debate and also discussion, and especially of concern, right?
That's right. And fear is unfortunately one factor that we just cannot control because it is something that is so personal and people respond to it in a very different way. So one person may respond to it, in a more cordial or kind manner versus those that become so fearful that they start moving their seats. They don't want to be near a particular person because of their ethnicity or background. And that is very unfortunate. And what we do know, and this is something that obviously has been proven, is that infectious disease threats affect everybody. It's not just one particular population. This is something that anybody can get. So whether you're Asian versus you're non-Asian, we're all at the same threat level, if you will. So to marginalize and discriminate against any particular population is something that we should make sure that is not happening. And I think from a public health standpoint, a lot of our public health leaders have basically made statements that this is something that can affect everybody. So discriminating against any one particular type of population is not something that should be tolerated at all. And I think one of the things people need to understand, again, is something I just mentioned, is that it can affect all of us. And so while the number of cases in China, a large majority are in China, they're obviously being reported in other parts of the world. And so, to discriminate against one particular population makes no sense in that regard.
I see. So we're currently in New York City, and you are a public health official in New York City. So can you just tell us a bit more about what the city is doing to actively, respond to this outbreak?
So just from an overall preparedness standpoint, I've done a lot of work in the hospital and public health sector based on just overall background in preparing for and responding to these types of events. And what we do is when it comes to an infectious disease threat from a hospital standpoint, the very first thing is being able to rapidly identify these cases, to be able to isolate them in a very timely manner and make the proper notifications both internally within our facility and to public health authorities.
Right.
And what we call these 3 I's, identify, isolate, and inform, there's a number of different resources that happen behind it. So from an identification standpoint, we want to make sure we have proper signages in our waiting areas. We have respiratory hand hygiene stations for people to put a mask on if they have signs and symptoms of a respiratory disease, to be able to notify staff immediately. We have engineering controls in place, administrative controls in place, personal protective equipment, things like that have been put in place through an overall hierarchy to be able to respond to this incident. From a clinician standpoint, we're providing in-service trainings and resources and things like that need to happen in these types of events. And again, when it comes to infectious diseases, the foundation is essentially the same. It's basic infection control. So it's reiterating those same basic principles that folks already know about, but it's just a reminder, a refresher, if you will.
I see. No, so this conversation has been super helpful. Thank you so much for all the information.
My pleasure.
So for our audience out there, we will keep you updated on the latest on the Wuhan coronavirus outbreak. And thank you so much for coming to our studio and giving us all the helpful information.
My pleasure.
Thank you and goodbye.